Frequently, a woman will come into my office at 60 years old or 65 years old and say, oh, I found a breast lump. And my first question will be, well, when was your last mammogram? And I'll hear, oh, I've never had a mammogram. And I'll ask, why? And their answer is frequently, well, there's no one in my family with breast cancer, so I won't get it. The reality is that the risk for developing breast cancer is 1 in 8 women. That's a really high risk. As we age, breast cancer just becomes more common. The issue regarding as to what age you should have your first mammogram is a controversial issue because the Prevention Task Force came out and said that you should have your first mammogram at 50 years old, have it every other year, and end at about 70 years old or 75. The American Cancer Society disagrees with that and had other recommendations, as do many other screening cancer organizations. The most common recommendation is to have your first mammogram at 40 years old and every year. The reality is we don't want to put an end date on that. The other issue that we deal with regarding breast screening is, should a woman have an ultrasound or should they not have an ultrasound? Ultrasounds in general are used in addition to a mammogram, not instead of a mammogram, because mammograms pick up many things that ultrasounds will never pick up. The mammogram still remains the gold standard of breast cancer screening. What's really important to remember is that if you find a lump, it needs to be evaluated by a physician.